we look at 2023 only, since the beginning of the year, we have documented 19,892 cases and 583 new deaths across 8 of our Africa Union member states. This gives us a case fatality rate of about 3%. And when we look at the same period in 2022, the same week in 2022, we see that there is a 7-fold increase in the number of new cases. And this is a big concern, considering that we are almost getting into the rainy season, and this can complicate response and control of cholera. So far, from the beginning of this particular cholera outbreak in March of 2022, 13 countries have been affected. And unfortunately, of those 13, we have spillover into 2023 in Burundi, in DRC, in Kenya, in Malawi, and Mozambique. In fact, when we look closely at the numbers, we see that for 2023, the vast majority of the numbers are coming from Malawi, and there is also evidence that there could be increased risk of spread to the neighboring countries, particularly Mozambique, which has seen a few cases in its facilities. When we look specifically at Malawi for cholera, we see that the case fatality rate for 2023 is 3.4%. We also see that the outbreak has affected most of the districts in Malawi. This resurgence of cases, even in districts that cholera was being controlled, is a very big concern for us and the government. And we are working very closely to see how we can be able to reverse that particular trend. You will recall last week I said that we will be sending a team to Malawi. The team is on ground, have done the assessment, and now are working on a plan how to handle the hotspots and to contain a spread from one area to another. To that end, the government of Malawi has taken some steps. Schools were closed. Indeed, schools were not reopened during this new year. The Blantyre City Council has also issued a temporary closure of the market and the bus depot to control the spread of cholera. So a lot of vaccination campaigns are continuing, engagement with the public so they understand cholera, ensuring safe disposal of waste, providing safe water. All these are continuing in collaboration with the government of Malawi and other partners on the ground. Cholera is preventable, and cholera is also treatable. We need to know how to deal with it, and we are working very closely with the neighbors of Malawi to ensure that we don't get cross-border spillage of this particular outbreak. Thank you very much, and that is the public health events of concern, and I'll hand it over to Dr. Mohammed to speak to us about the neglected tropical diseases. Thank you.
Thank you, Director. Thank you for the invite. So Monday 30th is the 4th World NTD Days, and the theme for this year is Act Now, Act Together, Invest in Neglected Tropical Diseases. Neglected tropical diseases are a set of 20 diseases or group of diseases that occur predominantly in tropical and subtropical areas. They include lymphatic filariasis, that we commonly call elephantiasis, onchocerciasis or river blindness, schistosomiasis or bilharzia, as well as human African trypanosomiasis that we sometimes refer to as sleeping sickness. If you agree with me, these are infectious diseases and other form of disease that have been with us for many, many years. Some of us can remember when we were growing up, people with these illnesses, infections, and up to today, the continent is still grappling with it. So entities are said to be neglected because they do not feature highly on the global security agenda, although they are key components of the Africa health security agenda, because Africa has a high burden of some of these diseases. On Monday 30th, we have a 2-hour webinar with presentation from the African Union, Africa CDC, and technical presentations from member states and partners. This webinar is part of our advocacy effort to bring more visibility to this serious public health issue and mobilize a political will to support member states to reach the global targets by 2030. We will also showcase some of the success stories from the continent, because we need to celebrate our successes as much as we are identifying the gaps and addressing them. The flyer for this event has been shared on the Africa CDC social media, including the link for registration. Please join us to support the fight against NTDs. Thank you. Back to you, Chair.
Thank you very much. Let me say thank you to Dr. Ahmed Ogwell, who gave us some detail on the 5 public health issues that the continent is dealing with, as well as Dr. Mohammed Abdulaziz, who spoke to us on the neglected tropical diseases, and inviting you, members of the media, to join that very important conference. Let's now move on to the question and answer section. And as stated at the beginning, our WhatsApp number is +251 94 550 2310. You can also come through live to us, and I see that we have one hand that is up. Let me just try to identify who that is. And that is Paul Adepoju. Paul, good morning. It's nice to see you in the new year. Please go ahead with your question.
Yes, thank you very much, and Happy New Year to you too. So my first question has to do with to Dr. Ahmed. A few days ago, we heard about the disappointing results of probably one of the world's most promising vaccine candidates for HIV. So I would like to know your comments on this, and how you think Africa can still continue to keep on the targets despite the pessimism around the emergence of a vaccine for the disease. Then I'm also curious about what is happening regarding long COVID on the continent. There is an advanced body of knowledge elsewhere around long COVID, but we seem not to be getting as much information from the country, from the continent, compared to elsewhere. Well, my third question has to do with this emergence of diphtheria and cholera, which are largely vaccine preventable. Do we know why this is happening? As an offshoot of the disruption of vaccination during the COVID pandemic, and how sure are we that other vaccine preventable diseases are also not reemerging as a result of disruption to the vaccine program across Africa? And what can we do to address this quickly? Thank you very much.
No, thank you, Paul. And I will respond to your first question on HIV and the one on diphtheria. For long COVID, I will ask Mohammed to comment about that. So the process of coming up with a human vaccine is always quite complex, and the vast majority of the candidate vaccines do not make it to the end. This is the reality of human vaccines development. The disappointing results are not the end of seeking a vaccine against HIV. Indeed, it is an opportunity for us to relook at how we have been designing our vaccines candidates, so that we can be able to get even closer to a vaccine candidate that will be successful. It is a setback, but it does not stop. And our scientists and researchers continue looking into which other molecules and platforms will be able to give us a vaccine against HIV. Disappointing, but it galvanizes us to be able to do more in this regard. On diphtheria and cholera, indeed even measles, right now, there is no doubt that the pandemic's effects are now being felt beyond COVID-19 itself. And the reemergence of some of these vaccines preventable diseases is a testimony to three things. One is the disruption in services during the pandemic, and that made it impossible to continue providing vaccines, to continue providing the public with information, to continue access to services across the continent. So this disruption that has been made by the pandemic season has been very costly, as we are seeing now with the reemergence of these diseases. Secondly, these diseases are reemerging because of climate change. The situations that we have on the continent are changing. We are seeing a lot more events like droughts and flooding, storms, and we are feeling that effect now, and it will get worse if we don't do something about it. So climate change has to be tackled directly so that it can reduce the risks that we are seeing currently. Finally, is the other reason why we are seeing the reemergence of these diseases is because we have not continued to engage with the public regarding vaccination for diseases that are vaccines amenable. It's been left to routine without that extra information going out to the public that we need to do it. And this has been costly. And therefore, as Africa CDC, we see a very keen interest that we continue to inform the public about all types of vaccines amenable diseases so that we don't get gaps in vaccination coverage amongst the population. But on long COVID, I invite Dr. Mohammed to respond to that. Mohammed?
Thank you, sir. Thank you, Dr. Ahmed. The long COVID defined as persistence of symptoms 2 months post-diagnosis is of concern the world over, and of course even in Africa. But in Africa, because of the challenge, the many competing demands, and our health-seeking behavior, which may differ from other parts of the world, characterizing it may not be as simple as the way it's done in other settings. However, some studies have been done, not enough in Africa, on how this long COVID presents, and it seems that 10% of people who have COVID have persistence of 2 or more symptoms 2 months after post-diagnosis, which is not supposed to be so. And in the Africa data sets that we've reviewed, the most common are dyspnea, that's the difficulty in breathing, and fatigue, generalized fatigue, 2 months post diagnosis. We intend to, right now we're partnering with some of our partners across the divide to really do a large-scale study. We're in the process of designing the methodology and how the data will be captured. And once that is completed, we will be able to better characterize the burden on the African continent. But be rest assured that Africa CDC will, as much as possible, look at into these complications that may continue to afflict those who have suffered COVID-19 and have failed to make full recovery 2 months post diagnosis. Thank you. Back to you.
All right. Thank you very much. We say hello to Sarah Jerving, who's with DEVEX. And Sarah has come through on our WhatsApp group, and she says, has the unknown flu in China only affected African citizens? Are there Chinese citizens that have been infected as well? Had the African citizens recently arrived in China, or had they been there for some time? And finally, she asks, which African nations are the 10 cases from? Dr. Ogwell, over to you.
Thanks, Sarah. The information we have is that the 10 reported cases are of African citizens with a history of recent travel to their country, and the country is Nigeria. There is no report so far of Chinese cases, but we can continue to work with China CDC for us to be able to give us the most updated information. But so far, no reports of local Chinese, only those who had recently traveled from Nigeria. But they are also continuing with the investigation to read the most updated reports on that particular unknown illness outbreak in Guangzhou.
All right, thank you very much. I am not seeing any questions coming through for now. So perhaps while colleagues are sending in their questions, let me just ask you about a rumor that seems to be spreading on some social media platforms to the effect that people who have been vaccinated are starting to suffer some consequences. Is there any truth to that? And can you just elaborate on the actual situation?
No, thanks, Wayne. And there's a lot of information, unverifiable, that is going around in discussions amongst the public. The evidence that we have as we speak does not point to any dramatic and new effects of the COVID-19 vaccination. No evidence so far has been documented, not by us. What we are reading about outside of the continent are not yet verified, and we wait to see if at all there'll be any verification from elsewhere in the world. Here on the continent, we don't have any. And my advice to members of the public will be seek your information from the right sources so that you remain safe. Every evidence that we have is that vaccination against COVID-19 is safe, and it offers you protection from serious illness. And therefore, we encourage you to take COVID-19 vaccine. Indeed, we encourage you to get your booster now whenever you fall eligible for that. In case anything were to change, we will be the first ones to let the public know. Thank you.
All right. Thank you very much. We still do not have any further questions, but perhaps, colleagues, if you want to ask your question, I'll just give you a minute to formulate your question and put it through to us so that we don't have questions coming in after we have started doing the summaries, as we do get sometimes. Sarah Jerving has just come back and she's asking, I just want to double check the city that you are referring to. Is it Guangzhou?
That is correct, Sarah.
All right, Sarah. So I think you have your answer there. All right, I think it is time for us now to go to our summaries, because I think all colleagues have the necessary information that they require. So let me start with Dr. Mohammed for just 1 minute, a summary of what you want journalists online today to remember from your briefing, or at least your call to action to them.
Thank you so much. We want to remind ourselves and everybody and journalists to help us spread this message that neglected tropical diseases is still with us on the African continent. They are, like the name suggests, neglected, not given the priority like COVID-19, for instance, is given, but they are an important source of burden of disease, including morbidity. If you've seen somebody having elephantiasis, let me use the common language, or river blindness, imagine how much productivity that person will have lost over the number of years in which he's carrying this a complication of these two neglected tropical diseases. Now we, Africa CDC, under our leadership, will be bringing advocacy to these neglected tropical diseases through an event on January 30th, which is the day that is set aside to remind us of the burden of NTDs. And we invite you all to please join us. The link to the flyer has already been posted by Nike One. And please join us, and so that we can discuss. We will have our member states, we will have the African Union, the Africa CDC director will be there to also add his voice to this very important aspect of reducing disease burden that really causes a lot of morbidity among our citizens. Back to you, Chair.
All right, thank you. Over now to the Acting Director of the Africa CDC, Dr. Ahmed Ogwell, for your closing statements of the key points.
Thank you, Wayne, and thank you very much, colleagues who've been with us today. The three things for takeaway today. The first is just the appreciation that Africa CDC's mandate is for prevention and control of disease. So it goes beyond health emergencies. And that is why, as Mohammed has presented today, when we are commemorating the World NTDs Day on the 30th of January, we invite you to join us and to also share that Africa CDC goes beyond health emergencies. We do the whole range of prevention and control of health, of diseases here on the continent. Second is, for COVID-19, get vaccinated. Get your booster. Be safer, because we don't know how the virus is going to behave in the coming days and months. Let not any spike in the numbers catch you unawares and unvaccinated. Don't let any new variant or a new sublineage affect you because you are not vaccinated. Get vaccinated, get boosted if you're eligible, so that you can remain safer with that protection of the vaccine. The third thing that I would like to say is outbreaks start and end at the community level. It is me and you who will see the first case or be the first case. It is me and you who can be able to inform health authorities when there is the first case, when there is a new illness. It is you and me who are going to act to ensure that that outbreak remains small and therefore does not disrupt our way of life. And therefore, I invite you that we need to act now. We need to act together, and we need to act so that we can safeguard Africa's health going into the future. I thank you very much for your attention today.
All right. Thank you very much, Ahmed. And I want to thank you, colleagues from the media, colleagues from the communication sector, and any other citizens who may have been listening to this broadcast, where the African Union, through the Africa CDC, brings you updates and information and advice on the public health issues around the continent. So special thanks to the Acting Director of the Africa CDC, Dr. Ahmed Ogwell, as well as Dr. Mohammed Abdulaziz, who spoke to us about the neglected tropical diseases. Thank you to colleagues behind the scenes from the African Union, which of course includes the Africa CDC, and special thanks to you, everyone who's joined us. Let us meet again next Thursday at the same time, which is 12 noon East African time. Have a blessed week.